Hello, my name is Jim Blando, and I'm an associate professor at Old Dominion University located in Norfolk, Virginia. Today, I'm going to discuss an overview of exposure assessment, and specifically in this section, I'm going to discuss the need and importance of assessing and understanding uncertainty in our exposure assessment and the implications of that uncertainty. So, uncertainty is a critical parameter in exposure assessment because exposure assessment is one of the key components factoring into our risk characterization and factoring into our risk management decisions. Risk management decisions are going to be impacted by how much uncertainty exists in the estimates of exposure. So, understanding and delineating uncertainty is really an important function of conducting an exposure assessment. So, what is uncertainty? Uncertainty is important because risk managers must know the uncertainty associated with exposure and risk estimates because it's going to impact their decisions. Making a decision oftentimes requires professional judgment, which is sort of the art of risk management. But in order for us to engage in the art of making those decisions, we need to know what uncertainty exists. The greater the uncertainty, the more margin of error you may incorporate into your risk management decisions. The more uncertainty you have, the more conservative you may be in making risk management decisions. It's also important that we communicate the uncertainty and document that as part of your exposure assessment. So, what are the sources of uncertainty? Well, data usually has a lot of what we oftentimes epidemiologists will refer to as dirt in the data. Especially in environmental scenarios, we don't have the kind of data we'd like to have. Sometimes we're limited by the amount of data we have or the detail of the data that we have. So, this dirt oftentimes results in uncertainty. For example, if I'm employing the EPA approach of scenario evaluation and utilizing models, I may have uncertainty about the given scenario. For example, if I'm looking at a lawn product and I may make assumptions about how I expect people to use this product. But if in fact people are utilizing the product differently than what I expected, my modeling may not be an accurate representation of what the exposures may be. So that can be a really significant source of uncertainty. I can't estimate exposures for things that I don't know about or incorporate into my model. So understanding and trying to evaluate and reevaluate, is my scenario that I'm modeling accurate, can be really important if that's the approach that you're utilizing for your exposure assessment. There can also be parameter uncertainty. For example, if I'm engaging in point of contact measurements of exposures, right? I obviously have some analytic accuracy in the analytic chemistry analysis of my samples. I may have a technique that I'm using that's only plus or minus 5%. So that's going to give me some parameter uncertainty. I may also have some uncertainty that results from just lack of science or knowledge about a given scenario or a given chemical. I may not know, for example, how quickly a chemical may be eliminated from the body. So I have to be very, very careful about making sure, for example, if I'm going to collect biomarker data, I want to make sure that the chemical is not all eliminated before I collect my biologic sample. So these are some examples where I can have dirt in the data and issues that will add or increase the uncertainty in any estimate I might make of the exposures. It's very important for you to keep in mind that exposure assessments are tools and not necessarily reality. You cannot assess something you don't include in your analysis. And just a couple quick examples. A few years ago, there were products that were sold on the market and they were marketed as bath salts. You take a bath, you put this in the water, and you soak in it. But it became well known that these bath salts could give a significant hallucinogenic high for people that consumed them or ingested them. The manufacturer could claim that, well, this product was never intended to be ingested, so therefore we never assessed the risk. Who would have ever thought somebody would ingest this material? So therefore, you may look at and say, should we allow people to market this product? But ingestion was never considered in the risk analysis because that misuse was never anticipated. So obviously, when they started having cases showing up in emergency departments with people in severely hallucinogenic states, the exposures were never assessed because it wasn't included in any analysis prior, because no one ever dreamed that somebody would ingest these materials. So again, you can't assess something that you do not include in your analysis. EPA has included something called conditions of use, where they try to establish in their exposure assessments what are the likely uses of this product. Is this product used as intended? So the key is that the exposure assessments are only going to give you estimates of exposure for the scenarios that you actually evaluated. If you have a given scenario that is outside the expected use of a product, the exposure assessment may not provide you with meaningful results. So we just have to keep in mind that exposure assessments are tools, and we always need to reassess, are these tools capturing what's actually going on out there in the real world? So how do we assess uncertainty? Well, we have some statistical techniques. Propagation of error and sensitivity analysis are some examples of some statistical techniques that we can utilize to help us assess uncertainty. We have epidemiologic techniques that we utilize to assess bias, confounding, role of chance, right? Is it possible that we have some way that we biased our exposure assessment? For example, people that I either model or measure their exposures, do I have people that are representative of your typical person who may be exposed to a given chemical? Or did I somehow have bias where I have people that have lower exposures than what the general population has, or has higher exposures than what the general population has? That would result in some bias in my exposure assessment. Epidemiologists are very skilled at assessing bias and techniques to assess what bias may exist and how that may impact your data interpretation. Confounding, do I have some factor that may alter the relationship between exposures and outcomes? And of course, sometimes we can have things occur just by chance, right? So epidemiologic techniques exist for us to sort of assess that uncertainty. The key thing I want to point out on this slide is when we think about uncertainty as health professionals and public health folks, it's important for us to keep in mind the precautionary principle. Our main job is to focus on protecting the public. So sometimes we want to take the approach when we think about exposure assessment, we might want to take the approach of being conservative for the sake of allowing for the fact that we very likely have some uncertainty, especially with environmental and occupational health scenarios, where oftentimes the data that we have is not as complete as we would like it to be. If there's something that I can do to reduce somebody's exposure, why not do it, right? So it's better to be safe than sorry and be a little bit conservative, because we always have uncertainty, and sometimes we have significant uncertainty in our exposure assessments because of the type of work that we do in environmental occupational health scenarios. What's the difference between uncertainty and population variability? Well, there is a difference, right? Population variability, sometimes we have to account for the fact that, for example, people are different sizes. People may consume different amounts of food. People may have different breathing rates. They may have different surface area for skin contact. So we have to understand population variability for us to have good exposure estimates, but we also have to understand and account for uncertainty unrelated to population differences, right? Sometimes we have just random chance. Sometimes we may have uncertainty that exists because our data is incomplete, and that also may give us variation in our exposure estimates. So we can have a range of exposure that we're estimating in our exposure assessments that may be due to differences in population. Children have a much smaller body weight, so the dose they're going to get from a given exposure may be much higher than the dose a larger adult may have who's much heavier than a child. So we may have a range of exposure simply because of population variability, but we may also have a range of exposure just because of uncertainty, because we have incomplete information or random variation, and that may also contribute to the range of exposure one might estimate. In EPA exposure assessments, oftentimes we like to list a range of what we anticipate the exposures would be based on uncertainty and population variability, rather than an individual point estimate, right? So that's where uncertainty and population variability needs to be accounted for. So, for example, when we think about uncertainty, we could think about uncertainty in terms of if someone is deciding something that they're going to drink. We don't know up front which beverage they might select. So that would be an example of the difference between uncertainty versus population variability. Population variability might be a child and an adult drink a different amount of liquids because they're different sizes. However, picking which drink a person might actually pick would be more representative of just uncertainty in your data. So to summarize, exposure assessment is a process. The objective, scope, level of detail, approach, and communication is all crucial and must be delineated in your exposure assessment plans. We must assess uncertainty and communicate that uncertainty to our risk managers. And exposure assessment is a tool. It's not necessarily reality, because it is possible for us to miss important data, scenarios, or information that's important for the exposure assessment. With that said, I just want to point out and acknowledge that this work was funded by the National Institute for Environmental Health Sciences, and thank you for your time today.